So the first set of speakers are going to look at what kind of innovative approach to EU R&D and public procurement is possible. And it's going to look at the pharmaceutical strategy as it proposes to pilot innovative approaches to EU R&D and public procurement for antimicrobials and their alternatives, aiming to provide pull incentives for novel antimicrobials in 2021. Now, how will the EU and national authorities overcome the challenge of financing the R&D and purchasing of compounds that are not yet on the market, and what role for the EU's Horizon Europe program, and what's the potential for joint procurement initiatives? What lessons can be drawn from the procurement of COVID-19 vaccines? So we're going to go through some of those topics right now. We have two speakers for this first part, and let me welcome Arjon von Hengel. He's a team leader for combating diseases unit at DG RTD at the European Commission. Arjon, how are you?
I'm fine, thank you. A little bit hot under the roof here, so unfortunately not in a climatized environment.
It's I'm going to give you, not to keep you too long so you don't pass out on us, so about 7-8 minutes, and I'll give you a 1 minute heads up towards the end, okay? The floor is all yours.
Thank you very much. So thank you first of all for the invitation. I think, of course, this is a very important event. Antimicrobial resistance is an important element and an important area for the European Commission. And of course, we're trying to move the situation that Florence has just been talking about. So if I can have the next slide, please. So our activities in the European Commission are actually entailed in this European One Health Action Plan against antimicrobial resistance. So if you're looking at health research, the corner actually where I'm coming from, we have very little specific action plans. So there's now one under development for cancer, for instance, but we already have one since 2017, and we had a preceding one specifically focused on antimicrobial resistance. So that tells you how important this issue is in terms of priority within the European Commission. So this action plan is now being implemented. It contains 75 actions under 3 pillars, and it's actually covered by many different parts of the European Commission. So there are 9 different directorate generals involved in this action plan. So if I can have the next slide, please. The action plan is based on 3 pillars. So the one is focusing on Europe itself, so making Europe a best practice region. The third one is focusing on the global aspect, shaping the global agenda on AMR. And the second one, that I will focus on right now, is on boosting research, development, and innovation on AMR. So this contains research in the broad sense for AMR. So that entails, for instance, infection control, research on AMR in the environment, etc. But again, for this specific event, I will focus on new antimicrobials in the second ellipse and on the new economic models and incentives, because we are very well aware, of course, of the poor possibility to use the market as such for the development and the bringing to market of these new antimicrobials. Next slide, please. So new antimicrobials, I think we're all convinced, especially in this setting, that there's really a great public health need for those new medicines. So the WHO has looked into what is in the pipeline. So they made overviews of the clinical development, also looking even at the preclinical development. And very importantly, they have set up a WHO priority pathogen list for the development of new antibiotics. So based on this, we actually know pretty much what we want, what is needed for our society to protect the health of our citizens. But the issue is, of course, how to get that. Next slide, please. So this is how antimicrobial development looks. I don't have to explain it probably too much in this setting, but of course you move from discovery into preclinical research, clinical studies, and finally commercialization. And at the end, you will reach then the market and the patients that's in need of these medicines. So along this pipeline, you have a decreasing risk level. So in the beginning, in the discovery, many things that might look promising are actually failing later on, and that tails down the further you get in development. On the other hand, the resources, and then especially the financial resources that are required, are going up. And there's a steep increase at the side of the clinical studies. This is really the expensive part where companies have to invest to get their product ready and approved and then to end up on the market. So normally this is the part where money is needed. It's called the value of debt, in the assumption that at the later stages, at the commercialization, you can recuperate these investment costs by means of sales. Now, of course, for new antimicrobials, that does not work. We know, because the new antimicrobials, we want to use as prudent and as little as possible to keep them being effective. So if you can do the next slide, please. Actually, we have a bit back, please. We have here a prolonged value of debt, and that's the problem. So with financial incentives, so-called push incentives or grants, you can support this first phase. You can put things into the pipeline, but what is really the trick here is getting things out of the pipeline in the end. And that is why there's a general agreement that pull incentives are needed in addition to so-called push incentives like grants. Next slide, please. So here I come back to the pharmaceutical strategy that Florence already alluded to. So the pharmaceutical strategy has been launched last year, and that contains these flagship initiatives. And the one I will focus on in my talk is this first one that is focusing on EU R&D and public procurement for antimicrobials and their alternative, focusing on this pull incentive. So since it mentions R&D, you can also directly see that the pharmaceutical strategy is not standing on its own. It is connected to other elements that we have within the European Union. And here it's of course important to mention Horizon Europe, our new framework program for research funding. Next slide, please. So now we're in a pandemic, a very difficult situation. We see that lots of new initiatives have been popping up in order to protect our population from COVID-19 and to react to that. So one of the important elements, and the one I would like to focus on here, is the advanced purchase agreement for COVID-19 vaccines. So here we see a purchase that is already being concluded or being agreed upon before the product has even finalized the clinical development and before it has been approved on the market. So this is a very interesting development. Now, let's be clear, there's a big difference here, because if we're looking at vaccines against COVID, we want to have loads of them. And as soon as possible, we would like to vaccinate the whole world population as soon as possible. And that is not the case with new antimicrobials. So there's no need for a high number of doses. There's actually an expectation that we will use them as little as possible. But there are other elements here. So with these advanced purchase agreements, we see that the European Commission and member states have joined forces to purchase medical products to combat an infectious disease. And that's actually the thing we're thinking about here also for antimicrobials. So member states are central to this process because they are in the end the procurers. So that means also that the procurer needs to agree on the scope in order to commit to buy the final product that will be developed. So the criteria has to be set to which a product has to live up to for a purchase here. So let's continue that stream of reasoning. Next slide, please. So within European legislation, there's an option that is called innovation partnership. And innovation partnership allows for a combination of research and procurement. Normally, this is very difficult because if you're supporting research and you then also commit to procure from that one company that you've already supported the research of, you're distorting the market and you're actually not dealing correctly with the competition. But here we have another issue. Here we have a very non-functional market with a high public health need. And especially for these kind of situations, there's this possibility to use an innovation partnership that allows for a combination of development and purchase elements tailored to public requirements. Next slide, please. So this is very new because actually just a couple of hours ago, we issued our calls for the next 2 years, so for 21 and 22 from our Horizon Europe work program on health. And within that program, you will see a topic that is focusing on the development, procurement, as well as the responsible management of new antimicrobials. And this is really focusing on establishing a pull incentive. So the element that we know that is missing. It is of course linking to the pharmaceutical strategy where this was already announced. And the idea is here to support research, development, and public procurement of antimicrobials. So using this European legislation that allows for a combination of development of new antimicrobials and the procurement elements, that of course should be tailored to the public health needs. Next slide, please. So this is not an easy thing. Setting up a pool incentive it's not for nothing that it has taken a very long time before moving in this direction. It's very expensive, it is very complex. So therefore, we provide the funding via this research call to create the conditions to establish such a future innovation partnership. Because you have to take there in account, of course, the experiences gained so far with these advanced purchase agreement for COVID-19 vaccines, but you also have to set out the requirements and the conditions for the final products to be developed and to be purchased. And this is not something that you can agree upon very quickly because you need a full commitment from the purchasers to, in the end, finally commit to buying this product. You cannot support only the development. This is a combination of development and procurement. Next slide, please. So what would we like to achieve with this financing? So it's of course addressing AMR, that is very clear. But the next point is the important one. So design a feasible option for a pool incentive that combines EU support for late-stage development of antimicrobials with procurement by member states and associated countries. So after that, we hope to launch the real pool incentive, but it will be necessary to, of course, create the right conditions to set this in place. So therefore, of course, we need to have the readiness and the interest of potential developers and suppliers of antimicrobials. We need to address the market failures and the challenges of availability and accessibility of the therapeutics. We also have to set the conditions for the development and the purchase of new antimicrobials, and very important also the requirements for financing. This requires money that should be clear from the start. So the financing element is a very important element to set on track here. And in addition to that, not to forget the conditions for prudent use of new antimicrobials, because such an innovation partnership allows you to set specific conditions to the contract that will be agreed within the final partnership on the delivery, but also on the use of the final products. Next slide, please. So that is in short what we have set in track here on the innovation partnership and the development of a pool incentive for the antimicrobials. Thank you very much for your attention.
Arjon, thank you very much. We'll give you extra minutes there because you're breaking news at the end with the announcement there. And thank you very much for going into some detail on that as well. We appreciate it a lot. And now our next speaker is Remco van Leuven. He's a Beam Alliance board member and CEO of Madam Therapeutics. Remco, are you there?
Thank you, and let me also thank Timo Wolke. I couldn't have had a better introduction because Timo, you ended with the slogan, "The time is to act now," and that is the start and title of my presentation. So can I have the next slide, please? You will hear a lot about economics of antimicrobial development today, but I think it's important to recognize that it's not the only problem that we're facing. Antimicrobial resistance development and drugs for it is just a multi-faced dragon. And I think we need to recognize that there are significant challenges in scientific research. Like Timo already alluded to, there is actually low awareness on appropriate use. But I still think that only makes the issue of the failing economic model even more prudent. So antibiotics are meant to be used appropriately and responsibly. That makes a lot of sense from a public health perspective, but obviously it's not such a good idea if you need to recap your investments, and those are significant. Next slide, please. So what you see here is a graph on the sales figures of US antibiotics and antifungals that have been approved since 2009. Most of these were originally forwarded or brought to the market by SMEs, and most of these sell at a price of about $2,000 to $3,000 per course. And you can see that regardless of this higher price compared to generic antimicrobials, most of these agents do not even make 10 million of sales per month. Many even don't even make 1 million of sales per month. So due to the low volume, this is clearly not a workable situation. And next slide. I think everybody in this audience probably agrees that market failure indeed hinders the clinical and commercial development of new leads. And that is waste because I think the push instruments like CARPEX, like the SME instrument and other mechanisms in Europe have been quite successful to bring these leads forward, but we lack the funds in bringing them into clinical development. And what is worse, new antibiotics have to compete with older generic and thus low-priced antibiotics. Again, makes a lot of sense from a public health point of view, but from an investment point of view, it complicates matters further to come forward with a commercially viable proposition. So you heard it from Arjon, you heard it from Timo, you heard it from our chair from BEAM. Additional incentives are required to refresh the antibiotic pipeline, and we need to work towards an ecosystem of integrating push and pull. It was very nice that Arjon gave us indeed a breaking news review of the call that is now out in Horizon Europe. And the next slide. The disappointing part of all of this is that although there is a lot of discussion, although there are now amendments that have been tabled to the pharmaceutical strategy, if you look what has been forward in actual pilot programs for pools mechanisms, it is actually just a handful. And that is actually quite disappointing. And even a person like Jim O'Neill is now publicly advocating that we actually need more bold moves. And I couldn't agree on that more. And I think it's important to just recognize that, yes, we have seen the joint procurement on COVID vaccines, and although that's sort of an innovation in health, these demand-side politics or pull mechanisms are actually very common in other industries like defense, energy, and transport. We wouldn't have a joint strike fighter if that wouldn't be subsidized on the demand side. We wouldn't have windmills if that wouldn't have been subsidized at the demand side. So if it can be done in other industries, why not in our industry? The second point that I would like to make is that the sense of urgency is often lacking. I've taken here an example from the government of the Netherlands. That is partly because I'm a citizen of the Netherlands, but also because Jasper Klaassen is giving some reflections. He is employee at the Ministry of Health. And what I would like to highlight is this letter that the minister sent on the Dutch response to infectious diseases, and I've highlighted here her response to the pilots in Sweden and the United Kingdom, where she says, well, this is important and we are monitoring these developments, as well as her reflection on the European strategy, where she says, I plan to closely monitor this development. So it's to be applauded, I think, that is getting all the attention from the Netherlands, but again, the sense of urgency, I think, is not here. Next slide. And I do feel the procurement of COVID vaccines, and I already alluded to this, really can be seen as game changer. So COVID vaccines have been centrally procured by the European Commission via an emergency support instrument that was done via advanced purchase agreements with several of the vaccine manufacturers. And this joint procurement has actually enabled to increase the buying power of smaller member states. And I think as a result of that, also resulted in a fair distribution in terms of health emergency and shortages of vaccine. Another important element is that this central procurement somehow seems to have enhanced the price transparency. So I think there has been a lot of publications on what governments and what the central procurement actually pays for various COVID vaccines. And before I discuss it in a bit more detail on the next slide, let me first highlight, I think, the most important point, that is that if you do a joint procurement, you can actually arrange something immediately with all 27 member states. And for that matter, if you look at COVID vaccines, not only with the member states, but also with the associated countries and the candidate countries. And Arjon already alluded to the fact that setting value on a pool instrument is actually not so easy. It's often seen and discussed as a value that needs to reflect the direct health gain to patients, and often that's assessed via health technology assessment, as well as some other elements that will be more discussed in detail by Lotte Steunte in session 3. But I think ultimately it leads to a process that is actually long and complicated. And my observation from joint procurement of COVID vaccines is that both procuring authorities as well as the pharma companies have been able to step over their own shadows. That is, they have accepted that speed was more important than profit maximization and the best value for money principles. So COVID vaccines, if you look at the mRNA vaccines, they're priced very similar to influenza vaccines, and I think it is not a coincidence. So Kevin Alterson in session 3 will talk a bit in more detail on what actually the value of pool instruments should be. My point for this presentation is we shouldn't make that discussion too complicated. COVID has shown that an arbitrary choice can actually work. Next slide. So I would like to end with the fact that I think there's two things to be done. So let me start with the lower part of this graph and again applaud Arjon and the European Commission to get out this call for a public-private innovation partnership to pilot and integrate public financing for development of new antimicrobials. I think that should be seen as a long-term objective. And in the meantime, we need other solutions. And I think AMR market failure needs to be recognized as an urgent problem. And once you do that, I think we can see that the COVID vaccine procurement has shown that joint procurement can work. And I think there's various mechanisms within the European Commission to make that work. The emergency support instrument that was used for COVID vaccines, HERA, EU for Health, the Recovery Fund. We will hear a bit more on this in later sessions. And my last slide is just a call to action. Antibiotics, developing antibiotics is really about saving lives. And our action today is no cure tomorrow. Thank you.
Thank you, Remco. Excellent. We're going to come back to some of those issues in just a moment. Just to remind our audience, you don't have to wait to the Q&A session to actually send your questions. You can do that now using the chat section. There was a notice just sent up a moment ago, so feel free to put your questions through now, and we'll put those to our panelists in just a few moments. Now, just to give some reaction to what we've heard, I'd like to introduce you to Jasper Claessen. He's a senior advisor at the Department of Pharmaceutical Affairs at the Dutch Ministry of Health. Jasper, are you with us?
Hi, yes, good afternoon. Can you hear me loud and clear? Or?
Loud and clearish. So the floor is all yours.
Thank you. Let me say that I'm very happy to be here and very thankful for this opportunity to speak here on this important topic. Already, I feel a bit put on the spot by the previous speaker Remco, with referring to a letter by our minister, which touched upon the right topics, but perhaps did not necessarily illustrate the sense of urgency that we necessarily that we do actually feel, but cannot always communicate as clearly on specific topics as we might do. But here I can speak a bit more freely, of course, which is very nice. I think it's very appropriate that we discuss this topic here with the Beam Alliance, as we all know that small and medium enterprises are responsible for the majority of innovation in this space. So very happy to discuss this topic with you. I think, as had already been alluded to by previous speakers, there's been many reports on the market failure in antibiotic development, and I think for us, at least in our analyses, it's quite clear that a new pool or reward incentive could provide a way forward to overcome the market failure that we see at the moment. Though I do want to stress that I think it's still quite unclear as to what the best approach would be. So in that sense, I do applaud the initiative that the Commission has taken with the call that was already described for a consortium to actually investigate this. So we're very happy to see that that this part of the pharmaceutical strategy is now being put in action. I think it's quite important when you decide on which incentive to use to determine whether the incentive is actually focused on innovation or on availability, as these would require very different incentive structures. The Netherlands believes that the solution, either way, is in international collaboration. No country can tackle this on its own. And I think here there's also some reference to our perhaps careful formulations in that letter. The Netherlands has no interest in developing its own scheme. I think that the solution lies in international collaboration, and I think we should be very wary of a patchwork of different schemes, which may provide some incentive to companies, but will not provide a proper solution to the problem at hand. So as far as we're concerned, collaboration is key, and therefore we definitely look towards Europe, and we're very happy that the pharmaceutical strategy has made such strong statements on this specific topic. So we're definitely here to support that approach. I think it's important to say that even though this can be organized centrally, this should be based on voluntary status. And also we do not necessarily want to exclude countries that are not part of the bloc. Associated countries could perhaps also be considered to participate in contributing to such a pool incentive or a procurement scheme. So we are, of course, following this with some enthusiasm, but we're also a bit critical because we are quite ambitious in this space. And we do wonder whether first steps towards a pilot on incentives does justice to the sense of urgency. So I'm quite curious, also now that we have our colleague from the Commission and also from Parliament here, for their opinion as to whether perhaps a stronger approach is already needed and asked for, so that we can provide more clarity for the innovating companies that are present here in this meeting. So a difficulty also for us lies in how a central incentive can actually be tied to the different national schemes that we see for procurement. And this must be considered quite carefully. And because at the moment, procurement of medicine is a national affair. And we see that procurement schemes are very different between countries. For instance, in the Netherlands, this is organized in a very decentralized manner. So the Dutch government doesn't actually procure medicines. And this has been a very peculiar year for us in that sense, because now all of a sudden we have taken this responsibility on ourselves for certain COVID treatments, but under normal circumstances, this is actually decentralized. So any incentive that we develop together as European countries will have to take into account the differences between the different countries and how this is organized. Another point of concern for us is that it is as of yet unclear who would actually set the R&D priorities for such a central scheme. And so what type of drugs are most urgently wanted? Different countries may have very different priorities here, and it's not necessarily clear to us whether, let's say, a WHO priority pathogen list would provide the right answer to needs, for instance, in Europe, or whether we actually want to take a global scope here. So I think this is still very much to be debated. Tied with this, for us, any central scheme must also consider stewardship. Any investment that we make together in new antibiotics cannot be seen separately from active stewardship measurements. We do want to take note of the fact that countries in Europe should work together on this, but at the same time should also look carefully at how they currently use antibiotics and how they are being prescribed, because of there's very large differences, and the level of resistance that is seen currently is also differing between the different member states. So this will definitely have to be considered when we discuss this topic together. And finally, one of the topics that I would like to introduce is the question of who would pay for such a scheme. It is not necessarily clear for us that responsibility lies solely with public funders, though I do want to stress that we feel a strong role and responsibility for ourselves here. But we also look to large pharmaceutical companies and private investors to take their responsibility as well. Previous speakers have alluded to a scheme that would invest not only in procurement, but also in research and development, And we feel that pool incentives are there in part to actually incentivize private investors to move back into this space. And so it's not necessarily a given that we should invest both in the development of new antibiotics, so late stage development, so to say, as well as offer market entry rewards or procurement prescription style engagement or what have you. And at the same time, I think we should also all recognize that antibiotics are a cornerstone of our health system, and that many of the very expensive innovative treatments that are being brought to market by large pharmaceutical companies depend critically on the availability of functional antibiotics. So we are not accepting the fact that large companies move out of this space and leave the public a payer, so to say, to solely contribute to incentives. So we feel that there should be an open dialogue as to how all responsible parties could contribute on this topic. So I'll stop there for now, so that we can also have a more open discussion and answer some questions.
Thank you, Jasper. Excellent. So we have a couple of questions in already. Just bring one of these up for you. And so one from Mark Gitzinger, and this to Timo and Arjon. How realistic is it to see, you can always comment as well, but principally Timo and Arjon, how realistic is it to see first actions from the EU Pharma Strategy and HERA by the end of this year, while the Horizon Europe call only asks for another research project to start, and how pull incentive, what would that look like as well? Let me go to Arjon first.
Yes, thank you. So I think, so let me quickly respond to the intervention of Mr. Claessens. I think that we completely agree, of course, that the European approach here is central. When we're talking about incentivizing and then especially pool incentives, it is fantastic to have initiatives on a national level, like what's happening in Sweden and what's happening in the UK. We will learn a lot from that. But of course, it's much more preferential to do that on the European level. You also indicated a number of issues that have to be addressed. So that is very clear, of course, that setting up such a pool incentive is not something that can be done very quickly. There are many aspects to take into account. Who is going to pay for what qualifies, etc. And you have added another set of these issues that should go into that discussion. And we're very well aware of that. So preferably, we would have all member states on one line already and starting with the pool incentives, but we know that that is not feasible. You need to have this preparatory phase. So, and that is why we now published this call on providing actually the possibilities for member states to come together and to discuss these issues and to really then come forward with a proposal on how such a pool incentive backed by the different member states as well as the European Commission could work. I think this preparatory phase is essential for any success that we can foresee for this.
Thank you, Arjon. Timo, anything else to add there?
No, actually, as we don't know how far the Commission has progressed, it's I can't answer it from the Parliament. We have been calling for that for a very long time, and of course it's good to take member states from the beginning, as we will need their okay to actually go ahead on any EU measures. But yeah.
Okay, thank you. I have another question here as well. It's just on a separate chat, and so one of the audience says, I'd be interested to hear more about from Arjon on the timeline for the calls proposal. You touched on some of this as well. But are we being told the project will look at the conditions needed, and how will the results fit into the flagship 3 incentives? Is that question clear enough for you, Arjon?
I will try to answer that. So on the timelines, so as I mentioned, today we have published our call for this activity that will stay open for a few months. I think by the end of the summer it closes. So then we expect proposals to come in from mostly member states, but I mean, it's up, of course, to any applicants to form a consortium on this. Then it is up to the proposal and the applicants behind that proposal what the duration of that proposal would be. So again, I would love it if they could conclude that in a very short period, but knowing all the issues to be discussed and the difficulties, I can understand that it will also take some time. Hopefully as short as possible, but it's up to the applicant to come with a proposal that is feasible and with a timeline attached to that.
Okay, just one other element on this. The preparatory phase, how long do you think this is going to take?
So the preparatory phase is actually the funding that we provide right now. And as I said, so that is up to the applicants that are preparing a proposal in submission to our call to determine how much time they would need for that.
Okay, so it's really, the onus is on them at this point as well. Okay, thank you. Casper mentioned, Remco, let's go put this to you. Casper mentioned that a global scheme is needed as well. How, do you think that's the case, or do you think we should be focused in Europe?
You know, infectious diseases are a global problem. So yes, this needs to be solved at the global level, but the problem is, you know, if you have like a 200 plus countries, how do you get all countries aligned? So you have to start somewhere, and then I think the North American economies and the European economies are a good place to start. And, you know, if we all do our share, then I think we can come up with a proposition that is actually of value to developers. Let's not forget that, you know, if you look at the global markets, the US and Europe both represent 50% of the biologics market. So if they take the lead, that is a good step, I think.
But the impact of AMR globally, everybody needs to buy into this as well. Do we need to build a global alliance, Remco, to ensure? I know that the market dynamics here as well, but we're also talking about public funding and how that dynamic can play and support and encourage private investors to participate, and for big pharma to participate where otherwise perhaps they don't have an incentive.
So I think here COVID again is a good example. So we started vaccinating ourselves here in the rich parts of the world, and we now get to recognize that once we are good on the way, we need to also start vaccinating the rest of the world in order to really get rid of this problem. And with infectious diseases, and antimicrobial resistance is not different. But the US and Europe, and perhaps some of the other G20 economies, represent the countries that have the power actually to make a difference. So I think there needs to make a start. Okay.
Thank you. I'm going to read some of the comments that you maybe can't see all these yourself. Let's paraphrase. So Andrea Chiarello from Pfizer, thanks for sharing. Very interesting, she says. Makes a number of points. Pull incentives, the first one, which aim at stimulating end-to-end R&D, like transferable exclusivity, extension market, entry rewards, etc. These are the best implemented at EU level. Second point, procurement, pricing and reimbursement, HTA reforms, which aim to increase the sustainability of the marketplace, but won't per se stimulate R&D. The European Commission should focus on point 1 in the pharma strategy, combined with push incentives. And these are complementary and important to build the ecosystem that speakers have referred to. Thank you, Andrea. And Marc Lemonnier says the preparatory phase for the implementation of pull incentives in the EU is facing two issues. The first, without pull incentives, the private sector will not come back, and SMEs do not have the luxury to be able to survive. Companies will go bankrupt. Second point, the impact on AMR of the COVID crisis is currently unknown, but could influence the epidemiology in Europe in a way that urgency could not be avoided. Does the European Commission understand that, and is it prepared to be able to act more quickly? Arjon.
Yes, we do understand that, of course, and that's why we are focusing on this for quite some time already with the action plans, starting even looking at the Drive AB that was mentioned before, looking at the economic issues. So we're very well aware of that. But again, so if we want to move towards a better landscape, including pool incentive, this is something that is very complex. If it was not complex, it would be there already. So I think in Europe, we want to take the first step there. And to move towards that, setting up this structure to prepare for a pool incentive that can work. Of course, also looking with the global reach further on, but I think setting this up on a global level will be even more challenging than setting it up on the European level. I think we have to start here. We see the urgency of the situation. We see We're in contact with several members of the Beam Alliance, so we're very well aware of the difficult position they are in. So I think the pool incentive should not be seen in isolation. It should be seen in combination with grants, with push incentives that we already have in place, with other financing possibilities that are there around the world. There's, for instance, also the AMR Global Fund, where companies, large pharmaceutical and mid-sized pharmaceutical companies are investing, and also supported with backing from European budget money. So I think we have to look at the whole landscape, the whole pipeline, and support that not only at one place, because then it gets stuck at another place. So we have to look at it in totality, which makes it, of course, more complex, but this is an issue that has high priority. So this is something that we have to move forward with.
Okay, thank you. We have 5 more minutes in this session, but we've got loads of questions coming in. So let me scan through these. One for you, Jasper. Would Jasper agree that the COVID-19 crisis might have changed the way EU member states, including the Netherlands, look at joint procurement and the idea of buying products that aren't yet available? Jasper.
Absolutely. I think it absolutely has changed a lot of things. I think primarily it has put infectious diseases back on the political agenda, which is really important to actually enact these type of changes. Like the last so many years, most of the attention has gone to other indications. Of course, oncology has been very much in the spotlight, but also politically. So patient organizations have been very good at, of course, attracting political attention, and therefore the money flows that way. I think we have to accept that is often how things go. So now, infectious diseases are back on the agenda, and so we have to sort of forge the iron while it's hot, as we say. So I think this is the right moment to actually make steps forward. And I think when it comes to procurement, for us, from a policy perspective, it has absolutely been a landslide change. To think that we would have entered these sort of common procurement schemes would have been unthinkable before the crisis. So I think what is important now that it is now on the table as an option, because we've already done it before. It's important to learn from the last year. How did we organize it? What went well? What can really improve? So there's steps forward. And if I can comment on what Remco has said on this topic before, of course, it's true that this last year has shown that a lot is possible. But we should not forget that was a crisis situation, and what we need to build here is something which is a bit more sustainable. Thank you.
All right, Timko, maybe you want to comment on that, but I want to give you another question as well. Thank you to Francis for that question. One from Hel Agat, and she asks, very central point being raised that if the public has been asked to pay for both push incentives and also pull incentives, what's left then for industry? And by extension, shouldn't the public then demand to have a much bigger say over intellectual property, which is a big issue in Brussels at the moment, pricing, distribution to ensure sustainable access to new antibiotics globally? Timko. Can't hear you. Let's see. Can somebody unmute? Can you unmute there? I think there we go. It went off and back on again.
Sorry, I didn't realize the question was targeted to me. I was waiting for Timo to respond.
Okay.
But actually, I think it's a very good point. And again, I refer to the COVID vaccines. You have seen interesting developments there, where, for example, Pfizer has said, well, we don't take any public support for development of vaccines, and in exchange for that, we ask a higher price. You see that other developments, other companies have been helped, like Moderna, like AstraZeneca, and in exchange for that, there's a lower price. So I think also here, and I agree with Jasper, it's time for prices, so it makes everything fluid. But it has shown that you can actually quite flexibly create workable models where both public and private interests are being mediated and come to the right price. So I just want to ask Jasper what your take is on these developments with COVID.
Let me just get a comment from Timo first, and we'll ask Jasper quickly on that. Timo.
Yes, thank you. So I can speak of course only from my group, the S&D group, and yes, indeed, we want more transparency in regards to pricing. So one of our main political priorities is, it was and still remains, is affordable access to medicines for all European citizens. So a proposal where the public is being burdened with the payment, this would still need to go through Parliament. And for now, I do not see how this could fly, at least with my group.
Okay, thank you. We got to close up on this session. Yeah, Jasper, any further comment to add, just in response to Remco?
Yeah, maybe 2 points. So I think there was a question asked about, for instance, what do we do with intellectual property? I think in the Drive AB consortium, like a number of models were discussed, for instance, where indeed, if you introduce a pool incentive, the intellectual property can then be transferred, for instance, to in this case, the organization that awards the incentive. And so there are theoretical models in which you can solve this. I guess in response to Remco, I mean, I think he's absolutely right. So I think the option is definitely on the table now. We just have to see what is workable, and how we can actually make so the funds come together in a logical way. But for us, it's important that pool incentives trigger private investment. Like it's not something that public payers can do exclusively.
Okay, thank you. I'm going to thank all our panelists here, Arjon, Remco, Jasper, and Timo, for a super contribution. We have another question there from Alessandro. I'll come back to that later on. I just want to keep on track for now. And our panelists, of course, are going to stay with us, and they can harass the other speakers later on as well with their own questions. So very fair.